Hello, everyone, and thank you so much for being here with me today. I'm Dr. Crisanto, and I've spent the last 25 years working in emergency medicine, treating countless patients who have experienced what I consider one of the most frightening medical emergencies anyone can face. And if you're watching this right now, I want you to know that what I'm about to share with you could quite literally save your life or the life of someone you love. So please, stay with me until the very end because the information I'm about to provide is not something you'll find in every health magazine or casual conversation at the dinner table. Let me paint you a picture. It's 3 in the morning. You're alone in your house. Everyone you care about is sleeping in their own homes, miles away. And suddenly, you feel it, a crushing pressure in your chest, a pain that radiates down your left arm, shortness of breath that seems to come out of nowhere. Your heart is racing, or perhaps it feels irregular. Your palms are sweaty, and a sense of impending doom washes over you. In that moment, the most important thing you need to understand is this: you have options, you have tools, and you have a chance to save your own life if you know what to do. You see, in my years working in the emergency department, I've noticed something crucial. The patients who survive heart attacks when they're alone are the ones who act immediately and decisively. They don't hesitate. They don't wait to see if the pain goes away. They don't convince themselves that it's just indigestion or muscle strain. Instead, they spring into action, and that decision to act quickly can make the difference between life and death. The statistics are sobering. Every year, thousands of people experience heart attacks while they're alone, and a significant percentage of those who receive prompt medical attention survive, while those who delay treatment often don't. This is why I'm so passionate about sharing this information with you today. Now, before we dive into what to do if you experience a heart attack while alone, I want to make sure we're all on the same page about what a heart attack actually is. A heart attack, or what we call a myocardial infarction in medical terms, occurs when blood flow to a portion of the heart muscle is blocked. Usually, this happens because of a blood clot that forms in one of the coronary arteries. Your coronary arteries are the blood vessels that supply oxygen-rich blood to your heart. When one of these arteries becomes blocked, the heart muscle beyond that blockage starts to die because it's not receiving the oxygen it needs. This is why time is absolutely critical. We in the medical community use the phrase "time is muscle," meaning that every minute that passes during a heart attack, more heart muscle dies. So if you're experiencing symptoms, every single second counts. But here's something I want to emphasize strongly. Heart attacks don't always present in the way you see them portrayed in movies. You won't always see someone clutch their chest dramatically and collapse. In fact, many people experience what we call atypical presentations, and this is especially true for women, for elderly patients, and for people with diabetes. Some patients describe it as a burning sensation. Others say it feels like pressure or fullness in the chest. Some experience pain that's more pronounced in their back, jaw, or neck. Some feel primarily shortness of breath. Some experience severe fatigue. And here's the really important part. Women and younger people are more likely to have these atypical presentations, which means they might dismiss their symptoms as something minor. But when you're alone, you cannot afford to be complacent about any unusual sensations. The symptoms of a heart attack typically come on suddenly, though sometimes they can develop gradually over hours. Classic symptoms include chest pain or discomfort, which is usually in the center of the chest and may feel like pressure, squeezing, fullness, or pain. This discomfort usually lasts for more than a few minutes, or it may go away and come back. You might experience pain or discomfort in other areas of the body, particularly your left arm, though it can also be your right arm, your neck, your jaw, your back, or your stomach. You might feel shortness of breath, which may occur with or without chest discomfort. You might break out in a cold sweat, feel nauseous, or experience lightheadedness. Some people describe a sense of anxiety or impending doom. Now, let me tell you what happens in my emergency department when someone arrives with these symptoms. We move quickly. We perform an electrocardiogram, which is an EKG, within 10 minutes of arrival. We draw blood to check for troponin levels, which are enzymes that leak out when heart muscle is damaged. We get a chest X-ray. We put you on continuous monitoring. We administer medications that can help dissolve the clot blocking your artery, or we prepare you for procedures like cardiac catheterization, where we can place a stent to open the blocked artery. But here's the crucial point. All of this can only happen if you get to the hospital. And when you're alone, getting to the hospital requires you to take action yourself. So let me now give you the specific steps you need to take if you're experiencing symptoms consistent with a heart attack and you're alone. The first thing you need to do is call emergency services immediately. Do not wait. Do not try to drive yourself to the hospital unless there is absolutely no other option, and even then, calling emergency services should be your primary action. When you call, you're not bothering anyone. You're not overreacting. This is exactly what emergency services are designed for. Tell them clearly that you're experiencing symptoms of a possible heart attack. Give them your location. Be specific about your symptoms. The dispatch operator is trained to help you and to send paramedics who are equipped with medications and equipment that can begin treatment immediately. While you're waiting for the ambulance, here's what you should do. If you're not already lying down, sit down or lie down in a comfortable position. This is important because when you're experiencing a heart attack, your body is under tremendous stress and your blood pressure might drop suddenly. Lying down reduces the risk that you might faint and fall and injure yourself further. If you have prescribed nitroglycerin, which is a medication that helps dilate blood vessels and improve blood flow to the heart, take it according to your doctor's instructions. If you don't have nitroglycerin prescribed, do not take someone else's medication. Just don't do it. It won't help, and it could potentially cause harm. Now, if you have aspirin available and you're not allergic to aspirin, chew an aspirin tablet. This is important. It's important because aspirin works as a blood thinner and can help prevent the clot from getting larger. The recommendation is typically 300 to 400 milligrams of aspirin, which is usually 1 or 2 regular strength aspirin tablets. But I want to be clear about something. I'm not saying take aspirin instead of calling for help. I'm saying take aspirin in addition to calling for emergency services. The sequence is crucial. First, call. Then, if you have aspirin, take it. Some studies suggest that aspirin taken during the early stages of a heart attack can reduce mortality risk, but only if emergency treatment follows. Here's another critical step that many people don't know about. Unlock your door or make it possible for paramedics to access you easily. If you're having a heart attack and you're alone, you need to make sure that when the ambulance arrives, the paramedics can get to you quickly. If you live in an apartment with a locked main entrance, prop open an inner door so they can get to you faster. If you're in a house, unlock the front door or the door that provides easiest access. Yes, I understand security concerns. Yes, you're vulnerable, but the paramedics need to get to you, and every second matters. You can worry about security once you're safe. Now, I want to address something that I've seen happen in my emergency department many times, and it breaks my heart every single time. Some people, when they start experiencing symptoms, convince themselves that it's nothing serious, and they try to push through it. They go to sleep, hoping the symptoms will resolve by morning. They think they'll just wait and see. They rationalize that the pain isn't quite like what they've heard heart attacks are supposed to feel like. Some people even try to exercise through it, thinking that movement will help. Please, listen to me very carefully. If you're experiencing symptoms that could indicate a heart attack, you cannot treat this as something to wait out. The risk is simply too high. When you're alone, you're already at a disadvantage because there's no one there to tell you that you're making a mistake, no one there to insist that you seek help. You must be your own advocate. You must trust your instincts. If something feels wrong, it probably is wrong. Let me share something from my experience that really drives this point home. I once treated a man named Robert, who was 72 years old and lived alone. He woke up at 2 a.m. with chest pain, nausea, and shortness of breath. His first instinct was to wait it out, to see if it was indigestion. He almost went back to bed. But something inside him, call it intuition, call it a feeling he couldn't ignore, made him reach for his phone and call emergency services. When the ambulance arrived 15 minutes later, his heart had already sustained significant damage. He spent 3 days in intensive care, but he recovered. He had a successful angioplasty, a stent was placed, and today, 3 years later, he's still alive because he made that decision to call for help despite his initial hesitation. Compare that to another case, a woman named Margaret, who was 65 and also lived alone. She experienced chest pain and shortness of breath one evening. She convinced herself it was just anxiety. She took some antacids, she tried to relax, she told herself that if it was serious, she would call for help tomorrow. Well, tomorrow never came for Margaret in the way she was planning. She had a massive heart attack that night. Her neighbor heard her collapse. When the paramedics arrived, they found her unconscious. She was resuscitated, but the delay in treatment meant that her heart had suffered extensive damage. She spent weeks in the hospital and had to undergo multiple interventions. She survived, but her quality of life was fundamentally altered because of those minutes she lost by waiting. These aren't just statistics to me. These are real people with real families, and every single story reinforces the same message. When it comes to potential heart attacks, you must act immediately. You cannot hesitate. You cannot rationalize. You cannot wait to see if symptoms improve. Now, let me talk about something that's particularly relevant for people who live alone: lifestyle factors that can reduce your heart attack risk in the first place. Prevention is always better than cure. I know this speech is about what to do if you're having a heart attack when you're alone, but I'd be remiss if I didn't emphasize that there are things you can do right now, today, to significantly reduce the likelihood that you'll ever be in that situation. First and foremost, know your cardiovascular risk factors. If you have high blood pressure, high cholesterol, diabetes, a history of smoking, obesity, a sedentary lifestyle, or a family history of heart disease, you're at higher risk. If you fall into any of these categories, you need to be working closely with your doctor to manage these risk factors. High blood pressure is particularly insidious because it often has no symptoms. You can have dangerously high blood pressure and feel absolutely fine. This is why regular monitoring is crucial. Similarly, high cholesterol often has no symptoms. You need to have regular blood work done to know your cholesterol levels. If you smoke, quitting smoking is one of the single most important things you can do to reduce your risk of heart attack. Smoking damages your blood vessels. It increases clotting risk. It decreases oxygen in your blood. It increases your blood pressure and heart rate. The benefits of quitting start almost immediately. Within hours of quitting, your blood pressure and heart rate begin to normalize. Within weeks, your lung function begins to improve. Within months, your cardiovascular function improves. If you need help quitting, please reach out to your doctor or a smoking cessation program. There's no shame in needing support. Exercise is another pillar of heart health. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic activity per week, or 75 minutes of vigorous intensity aerobic activity per week. This could be brisk walking, cycling, swimming, jogging, or any activity that gets your heart rate up. Exercise strengthens your heart muscle, helps you maintain a healthy weight, reduces blood pressure, and improves cholesterol levels. It also has mental health benefits, reducing stress and anxiety. Diet is another critical factor. A heart-healthy diet includes plenty of fruits and vegetables, whole grains, lean proteins, and healthy fats. It limits saturated fats, trans fats, sodium, and added sugars. The Mediterranean diet, which emphasizes olive oil, fish, fruits, vegetables, and whole grains, has substantial research backing its cardiovascular benefits. Stress management is also important. Chronic stress increases the risk of heart disease. Find ways to manage stress that work for you, whether that's meditation, deep breathing exercises, yoga, spending time in nature, or pursuing hobbies you enjoy. Regular medical checkups are essential, especially as you age or if you have risk factors. Your doctor can monitor your blood pressure and cholesterol, assess your overall cardiovascular health, and recommend interventions if necessary. If you haven't had a checkup in over a year, I strongly encourage you to schedule one. Now, back to the acute situation. Let's say you've called emergency services, you're lying down, you've taken aspirin if appropriate, and you're waiting for the ambulance. What else should you be doing? If you start to feel faint or dizzy, elevate your legs above your heart. This helps maintain blood flow to your brain. If you have someone you can call, a friend, family member, anyone, call them and let them know what's happening. They can provide emotional support, and they can also serve as a backup in case something changes. If you start to feel nauseated and actually vomit, turn your head to the side so you don't aspirate vomit into your lungs. Some people have asked me whether they should attempt CPR on themselves if their heart stops. The simple answer is no. You cannot perform CPR on yourself. CPR requires chest compressions and rescue breaths, and you cannot do this to yourself. However, if you have a defibrillator available nearby, some public places are now equipped with automated external defibrillators, or AEDs, and you have a moment of consciousness. You could potentially use one on yourself, though this is rare and would require you to have received training on how to use it. Let me also address the psychological aspect of experiencing a heart attack alone. Fear is a natural response. You're facing a genuine medical emergency. You might be thinking about your mortality. You might be worried about what happens if the ambulance doesn't arrive in time. These thoughts are understandable, but I want to encourage you to focus on what you can control. You've called for help. You're following the appropriate steps. The paramedics are on their way. They are highly trained professionals who have handled this situation countless times. Trust in the system. Trust in the training of the people who will be treating you. One thing that concerns me is that some people, particularly men, and particularly in certain cultural contexts, might feel reluctant to call for help because they don't want to be seen as weak or because they don't want to burden others. Let me be absolutely clear. Calling for emergency services when you're experiencing symptoms of a heart attack is not weak. It's not a burden. It's the appropriate medical response to a life-threatening emergency. Any paramedic, any emergency room physician, any healthcare provider will tell you that calling for help early is exactly what you should do. There is no courage in suffering silently through a heart attack. There is courage in acknowledging that you need help and taking action to get it. I also want to address medication adherence because it's so critical. If you've had a previous heart attack, or if you have been diagnosed with coronary artery disease, your doctor will likely have prescribed medications to take regularly. These might include aspirin as a daily preventive, statins to lower cholesterol, beta blockers to reduce the heart's workload, ACE inhibitors to lower blood pressure, or other medications. Taking these medications exactly as prescribed is crucial. Some patients stop taking them because they feel fine, or because of side effects, or because of cost. But stopping these medications significantly increases your risk. If you're experiencing side effects, talk to your doctor. If cost is an issue, talk to your doctor or a pharmacist about generic options or programs that can help with medication costs. Do not simply stop taking prescribed medications. Let me also talk about CPR training for those around you. If you live alone, your immediate neighbors or close friends might be the first ones to find you if something happens. I encourage you to share this information with people in your life. Encourage them to take a CPR class. If someone nearby knows CPR, they can begin chest compressions immediately, and this can make a life or death difference in the minutes before the ambulance arrives. Every year, thousands of lives are saved by bystanders who knew CPR. Now, let me discuss something that's often overlooked. What happens after you've recovered from a heart attack? If you experience a heart attack and you survive and you receive appropriate treatment, your life doesn't end. Many people go on to live full, active lives after a heart attack. Cardiac rehabilitation programs help you recover physically and mentally. You'll learn about heart health, medication management, appropriate exercise, and dietary changes. You'll meet others who've gone through similar experiences, and there's tremendous value in that community. Some of my patients who've had heart attacks tell me that the experience, while frightening, became a turning point in their lives. They made positive changes. They spent more time with people they love. They pursued goals they'd been putting off. Life doesn't stop after a heart attack, but it does change, and often it changes for the better. Let me circle back to the most important message. If you're alone and you experience symptoms consistent with a heart attack, call emergency services immediately. Don't delay. Don't wait to see if the symptoms improve. Don't try to self-diagnose or self-treat. Call for help now. The paramedics who respond to your call are trained to begin treatment in the ambulance. Advanced life support paramedics can perform an EKG in the field and transmit it to the hospital, allowing physicians to prepare for your arrival. Some hospitals have programs where they prepare the catheterization lab as soon as paramedics notify them that they're bringing in a patient with a suspected STEMI. That's an ST elevation myocardial infarction, a type of heart attack where an artery is completely blocked. In these programs, the average door-to-balloon time, meaning the time from when you arrive at the hospital to when a catheter is used to open the blocked artery, can be less than 90 minutes. This is life-saving treatment that only becomes possible when you make that call. I've also been thinking about the emotional toll that living alone can take and how it might make someone less likely to reach out for help. If you're lonely, if you're isolated, if you feel like no one would care if something happened to you, I want you to know that's not true. Somewhere, someone cares. And beyond that, there's a system, the emergency medical system, designed to care for you when you're in crisis, regardless of your social status or connections. The paramedics don't judge. The emergency room doctors don't judge. We're there to help, to treat, to save lives. Your life has value. Your life matters. If you're experiencing depression or suicidal ideation, along with being lonely or isolated, please reach out to a mental health professional or a crisis hotline. Many communities have resources available for people who are struggling. One more critical point. If you're alone and you think you might be having a heart attack, but you're not completely sure, call for help anyway. It's far better to call paramedics and have it turn out to be a false alarm than to not call and have it be a real heart attack. Paramedics respond to thousands of calls every year where the symptoms turn out not to be a heart attack. They're not going to be upset with you for calling, they're just going to be relieved that you're okay. In medicine, we have a saying, when you hear hoofbeats, think horses, not zebras, meaning the most likely diagnosis is usually the right one. If you have symptoms that sound like a heart attack, assume it is until proven otherwise, and call for help immediately. I want to also emphasize that while I'm focusing on what to do if you're alone, the same principles apply even if you're with other people. If you're with family and you start experiencing symptoms, tell them immediately. Don't downplay your symptoms, hoping they'll go away. Alert the people around you. If you're at work, notify your supervisor or a colleague immediately. If you're driving, pull over safely, call emergency services, and turn on your hazard lights so that someone sees your car and stops to help. Being with other people is generally safer than being alone during a heart attack, but the response needs to be rapid, regardless. Let me also talk about certain specific situations. If you're elderly and living alone, this information is particularly important for you. Elderly patients sometimes have atypical presentations of heart attacks, and elderly people are more likely to have comorbid conditions that complicate matters. If you're elderly, please make sure your doctor knows about any symptoms you're experiencing, no matter how minor. Stay up to date with preventive care. Keep your medications organized. Consider wearing a medical alert device so that if something happens, responders will know your medical history immediately. If you have diabetes, you're at higher risk of heart disease, and your heart attacks might present differently. Diabetics are more prone to having silent ischemia, where heart damage occurs without pain. This is why regular monitoring is particularly important if you're diabetic. If you're a woman reading this, know that women's heart attacks often present differently than men's, and women are more likely to have atypical symptoms. Don't dismiss chest pain as anxiety or indigestion just because you're a woman. If something feels wrong, it probably is. If you have significant anxiety, you might find it hard to distinguish between anxiety symptoms and genuine cardiac symptoms. If you're unsure, call for help anyway. The paramedics can sort it out. I think it's also worth mentioning that advances in cardiac care have been remarkable in the last few decades. We have better medications, better devices, better surgical techniques, and better rehabilitation programs than ever before. If you have a heart attack today, you're much more likely to survive with minimal lasting damage than you would have been 30 years ago. This is incredibly hopeful. This is why rapid access to medical care is so critical, because we have so much we can do to help you if you get to us in time. So to summarize everything I've shared, if you're alone and experiencing symptoms consistent with a heart attack, here's your action plan. Number 1, call emergency services immediately. Be clear about your symptoms. Give your location. Don't hang up until they tell you to. Number 2, if you have prescribed nitroglycerin, take it. Number 3, if you have aspirin and you're not allergic, chew an aspirin. Number 4, sit down or lie down in a comfortable position. Number 5, try to remain calm. Number 6, unlock your door or make it easy for paramedics to access you. Number 7, if you have someone you can call for support, call them. Number 8, wait for the ambulance. Don't try to drive yourself unless there's absolutely no other option. This information could quite literally save your life. It could save the life of someone you love. Please share it. Talk about it. If you know someone who lives alone, particularly someone elderly or with known risk factors, share this information with them. Have a conversation about what they should do if they think they're having a heart attack. And now, before I finish, I want to ask you for something. If you found this information valuable, if you believe this could help people you know, please subscribe to this channel. By subscribing, you're ensuring that you'll get access to future videos about health, medical emergencies, and evidence-based medical information. Please also leave a comment below. Tell me your thoughts. Have you or someone you know experienced a heart attack? What was your experience? What would have helped? Your comments help me understand what information would be most valuable to share in future videos, and your experiences can help others who are watching and trying to understand what they might face. The comment section becomes a community of people who care about their health and the health of their loved ones, and that's incredibly valuable. Thank you so much for being here. Thank you for taking the time to learn this potentially life-saving information. Remember, you are not invincible. You are not too young. You are not too healthy. Heart attacks can happen to anyone at any time. But if you know what to do, if you act quickly, if you call for help immediately, you dramatically increase your chances of survival and recovery. Take care of yourselves, live well, and please reach out for help when you need it. That's not weakness. That's wisdom.